Could you just start, Bart, by talking about, tell us a little about Wellmont and the area it serves for those unfamiliar with the system?
Absolutely. Wellmont is a rural hospital chain of about 7 hospitals in Northeast Tennessee and Southwest Virginia. We cover about 20 counties in those 2 states with 2 tertiary hospitals in Tennessee and then 5 rural hospitals both in Tennessee and Virginia that support our tertiary hospitals.
And could you tell us a little about the genesis of you wanting to take a closer look at supply chain? What were the conversations going on at Wellmont that preceded you undertaking this?
Absolutely. In today's market, one of the challenges that we have where reimbursements are generally not increasing is we have to look in every corner, nook, and cranny to try to identify opportunities for cost savings. And with supply chain being about the second biggest avenue outside of labor costs, we decided to concentrate our efforts in that particular area, working in many different on many different proposals to take costs out of the system while continuing to deliver high quality care with compassion in our marketplace.
Could you tell me a little about what you've undertaken to try and improve the performance of your supply chain? I know you mentioned lean principles was an aspect of this.
Absolutely. Again, coupled with partnering with outside vendors, our GPOs that help us to identify the lowest prices in really across the country, and then accessing those prices by partnering with other organizations that are in the same positions that we are and looking for cost savings. We have been able to spread our wings, so to speak, a little bit further and wider than just our footprint that we cover in Northeast Tennessee and Southwest Virginia. And partnering with those GPOs allows us to negotiate and put into place our desired product at the lowest possible price for our region. And that is helping us to take costs out of the system. And then we're coupling that with a lean process, just looking at our procedures, processes and procedures that we have going on within our organization from a process standpoint, reducing opportunity for expense creep on us, and then building those processes across our 7 facilities to take advantage of the lean process and taking costs out of the system.
Mm-hmm. Were there any particular products, items within the supply chain that you found were particularly something that needed to be addressed, or what were the problem areas you uncovered?
Right. First and foremost, it's a wide diversity of similar products in each of our 7 hospitals, with sharing information across our system. We recognize that Hospital A would be using one product for the same service, and then Hospital B would be using a different one. So we were at the very basic point not even centralizing our purchasing power within our own system. And as we sit down at the table and we start talking about tackling these processes and we expand that discussion beyond the walls of our health system, we can get similar decisions made so that we can concentrate on a similar product, not only that spans our system, but it spans other healthcare systems too, and therefore drive that cost down lower. We're also participating in several bundle programs, the orthopedic bundle being one of those, where with our physician partnership coming to the table in the goal of taking costs out of the system. They've been very helpful in helping us to identify the complete continuum of care for orthopedic joint replacements, and not only the implant, but going beyond the implant to the trays that we use, the cement products that we use, standardizing all of those, and then being able to take those costs out of the system as well. Similarly, in oncology, we're in the oncology bundle that's going on nationwide right now. We've been in that for a year. We're seeing great savings associated with that as well.
Mm-hmm. Can you put a number to it as of now, like what you've been able to save in your supply chain through these initiatives?
Well, just in the past year, we've been able to take out about $3 to $4 million worth of supply expense, and with supply expense running generally about $10 million a month. That's gets to be a pretty significant number for us.
Mm-hmm. Just in closing, Bart, advice for your hospital or your peers who are sort of just getting started down this road that Wellmont has been on now for a while?
Sure. I think, again, faced with all the change that we're looking at in healthcare today, the fact that our revenues per encounter are really not going to be going up, and so we're going to be faced with continuing to look for the lean process by taking costs out of our system in how we perform, and then from a supply standpoint or from a drug standpoint, using the supply chain to help us negotiate better pricing to squeeze that number down as small as possible, because we're still going to be there taking care of the patient and their needs.
Okay. Bart, thanks so much for your time.
Thank you very much. Appreciate it.
All right, great. Thank you so much.
Okay.
That's great. Thanks for doing this.
You bet.